All right, welcome everybody to our another episode of Rant and Pray. And I'm so excited today because I am joined by the wonderful Shereen Roberts. And Shereen, she's going to introduce herself, but I've known Shereen for I don't know how many years. And we kind of bumped into each other in different churches and just on social media. And Shereen is a mother, a wife, a doctor. So excited to have you as a doctor here as well. And we're going to be talking about breastfeeding, and we're going to look at the importance of breastfeeding and breastfeeding in Black communities as well. So thank you so much for being here, Shereen. You're so welcome.
Thank you very much. Thank you, Maureen, for inviting me. Yeah, as I was telling you earlier, it's my first time doing this, so I feel privileged to share my experience on this occasion. And yeah, breastfeeding has been a big part of my journey for the past nearly 2 years now. So yeah, it's exciting to be able to talk about my real experience.
Yeah. All right. So welcome. Thank you so much for coming. And yeah, take it away. Tell us about you.
So as you've heard, I'm Shereen Roberts. Firstly, I've been married for 13 years to my husband, Rick Roberts. And we spent many years, just the two of us, until just under 2 years, my son arrived. He's nearly 21 months now. So we have one son, his name is Richie, and he's a really great boy. He's thriving. That's my kind of wife and mother kind of status. It kind of work life, I am a GP. So I've been a doctor for 6 years now and a qualified GP for 3 years. Nice. So still kind of in the early end of my career, definitely. But definitely enjoying the process of, becoming more experienced in that field. Yeah. So
awesome. That's amazing. I'm slightly jealous because I wanted to be a doctor for years and years, but I don't think it's now when I look back, I'm like, I'm glad I did not become a doctor. I don't think it was personally for me, but I have so much respect and admiration for doctors, and especially for women who are doctors, juggling work and being a wife, being a parent, being, a mother, a sister, whatever else you do in your spare time. I think it's amazing. Well done.
Oh, thank you. Yeah. No, I mean, I feel blessed and grateful that being a GP actually gives me a bit more flexibility than a hospital doctor. So I've been able to be a bit more, I've been able to manage my workload, which has given me more time with my, to be at home with my son as well. So I get the balance.
Awesome.
It's quite good. Yeah. So.
Yeah, that's good. That's really good. And what has it been like during COVID and being a GP? Have you noticed?
So for me, because I'm actually a locum GP, so I'm not attached to one practice.
Okay.
So I and pretty much I book work according to where it's available. So during COVID times, I wasn't as busy as I had been previous.
Okay.
I did a bit more out of hours work. So I do some out of hours like Western urgent care work, and to kind of just make sure I keep up with the finances and things. Certainly it has been different in terms of patient contact, as you can imagine. A lot of people not being able to actually come into the practice now, so having to do a lot of consultations over the telephone, which brings up its own challenges, because obviously some problems need kind of face-to-face assessment. So kind of having to deal with that in the early days, not knowing who you're able to bring in and things like, or not really being able to bring anyone in, it's definitely was challenging. But GPs are still very, very busy. They still, even though they're not seeing people physically, they are dealing with lots of telephone calls, basically doing consultations on the phone or over video. So so the workload is still, it was definitely busy. Busy now anyway.
Which is probably quite stressful. Like I find if I'm on Zoom, for church, say for example, for like an hour or two, I leave feeling really exhausted. So I could just imagine like doing all your work on the computer and talking to people on video. Yeah. Oh, wow. Well, yeah. So let's talk about, so you've been married for 13 years. That's amazing. Like, I thought 6 years was amazing.
People always wonder how old I am because I don't recall.
But you got married very young.
So I was 22 when I got married.
That's really young.
Yeah. So I guess I guess it's young.
Yeah, maybe not for Northern Ireland, but I think in general people are getting married later. But I find people do get married younger here in Northern Ireland. And your husband is amazing, Rick. He's just he's lovely, African American, and full of life, like and takes lovely pictures, preaches really well. I'm not sure fitness as well. He does a lot of fitness. So we love Rick, and he took Ezekiel's pictures for our pictures for Ezekiel's second birthday, and first birthday, because he's going to be two. And it was just such a blessing. You guys are so blessed. So let's talk about breastfeeding then. So your son is nearly 2. Did you think about breastfeeding? Like, was it something you had to consider, or did you think, there's no option for me, I have to do it?
So I think for me, I was more that, I was really determined to breastfeed. So before I had him, I was like, yes, breastfeeding is the way I'm going to go. I thought, it was just the natural experience. It would be a natural experience. It's a natural process. So I didn't think it would, there'd be anything much to it. You know what I mean? I just thought, latch on and there we go. We just breastfeed to our heart's content. But that soon wasn't the case. But no, I was very determined to breastfeed. I knew before I had him that I wanted to do my best to make sure I breastfed him. So.
Awesome. And how have you found it? What was the initial, like, how did you find the first few weeks?
So I think starting off, certainly I had so my labor was maybe a bit more difficult than I was expecting as well. So everything kind of started off really well. I was managing my contractions without pain relief, and by myself. And then we got to the hospital when I was 4 centimeters dilated. So I went to midwifery led, and things were kind of going along fine. I was in the water bath. But then after kind of the first 4 hours, I hadn't really progressed that much. So I was kind of assessed, and my waters hadn't broken yet. So I was back in the water bath, and we thought, let's just see how it goes, because I was still managing pain fine. But then I had to have my waters broken after another 4 hours, and I hadn't really dilated that much, and Richie was in distress. So the reason why I tell this whole story is because a lot of problems with breastfeeding can kind of start from the kind of delivery, so before the baby's born. So in the end, I ended up having to be induced, have the drip to kind of progress my labor, because it wasn't progressing. And then I ended up having a forceps delivery. Wow. So, and then when he was born, we laid him skin to skin, but we didn't breastfeed. They say, like, within the golden hour, that's when you should try to breastfeed, to try to start established feeding. But I was exhausted. The midwives, they were busy in and out. They might have tried once to latch him in that first kind of maybe hour, but it didn't work. It didn't happen. So I didn't think anything of it, and then we were just had to wait for me to be moved to a bed. So it wasn't until quite a few hours later till we properly tried to breastfeed again, and it wasn't really straightforward.
It's
so it was the latching. So he didn't latch on straight away, and then just from there it was just the process of trying to work out what could I do to help him feed, essentially.
And how long did it take to actually get him to latch?
I would spend, I don't know, even up to 10 minutes sometimes, just trying to get him on my, doing the maneuvers, trying to get him on my breast. So we did, he was we were trying to feed in the first few weeks. Certainly, he was feeding, but it just was very difficult process of getting him on the breast. One, I had problems with my wrist as well, inflammation, and that was difficult in terms of maneuvering onto my breast. And then the other thing is he had a bit of a tongue tie. So I don't know if it wasn't really a major tongue tie, but I just was like trying to think of all these different reasons, why he wasn't latching. So when it was a couple of days old, we ended up getting, he had the little procedure just to snip the tongue tie. But it didn't, resolve things. There was obviously lots of factors, that was, preventing us from establishing a good latch. So I think it took a good, I don't know, I definitely say 5 months for us to feel fully comfortable with breastfeeding, but I certainly say the first kind of 6 weeks definitely was very tough. Because he was constantly wanting to feed. So, the first stage is they cluster feed. So you're feeding for hours. You're just sitting on the couch for hours feeding.
Exhausted, thirsty.
Exactly, thirsty, hungry. They want to feed through the night, maybe not sleeping. So Richie wasn't really a night sleeper. So after cluster feeding for say 8 hours, I was exhausted. I needed sleep. So I had to give him to Rick. And Rick's been so great and supportive. He took over. But the only thing is, how could Rick feed him in the night? That was the question. So we ended up giving him a bottle of formula in the night for for between 3 weeks and 6 weeks. Until I could start pumping. Because I didn't want to start pumping too early because that interferes with supply. So then we nearly fully exclusively breastfed for 6 months. It was just those few weeks where we introduced the formula, just because I was so exhausted. Rick needed to feed him during the night. So and then we took over. I started pumping and then substituted that with breast milk at night. So Rick still was up with him, but he fed him breast milk, with the bottle. So
it's amazing. And it's like the first few weeks, the first 6 weeks, I think are just horrendous. You're trying to your body's in pain. You're bleeding. Your nipples are probably sore because you have so much milk or not, or if they're not latching properly, the milk is not moving as much. You're just stressed, your brain, you just don't feel like yourself, and then having to deal with the latching, that would have been, different. And something another added stress. But it's amazing that you didn't give up. I know a lot of people do end up giving up. And I also love that you were able to give him formula at night. Because it was better for you to get enough sleep and to stay up the whole night,
Definitely. Lack of sleep really affects me in a big way emotionally, and just coping in general. So once I wasn't able to do that, I wasn't able to care for him properly. It just affects your ability to just function. Everyone knows sleep is important, and certainly having to deal with breastfeeding and lack of sleep was very challenging. So no, definitely, that had to be an option because I couldn't go on anymore. Just in that same way.
I agree.
But I just, sorry to cut you there. No, I was just going to say, certainly a lot of people do unfortunately give up, and it's not. It's not an easy. I'm sure it's not an easy decision even to decide to give up. I know a lot of women struggle with that, but it is. It really is challenging breastfeeding. And so I really respect anyone who everyone who gives it a try and tries to do it, but you have to do what's best for you at the end of the day. And I was just someone who was 100% determined that I wanted to breastfeed. So I was stubborn, and I just kind of stuck with it, no matter how it made me feel.
I was the same too, and similar experience with my first labor, just really, really long, but I was determined to give birth naturally, so I was just not giving in to the to the doctors. I said, unless I'm dying and the baby's dying, I want it, because this is when we were in America, and it was just, it would have been so much harder if I had a C-section away from home, away
Yeah.
from anybody that could help me, even though I had a lot of friends and
Mm.
around me. But I just think it's different. It's different because you can't expect people to give up their lives to come and look
Yeah.
after you.
No,
So that,
definitely.
yeah, so I was determined. I did pay no medication as well, no pain relief with my first baby. And the reason for that was because I wanted the baby to kind of come out alert so that they can
Mm.
breastfeed. I had read
Yeah.
so much about breastfeeding and the baby
Yeah.
being alert in those first, the golden
Yeah.
hours, like you were saying. But I was in labor for like 24 hours. I was
Mm.
exhausted.
Yeah.
And then I gave birth and I was pushing for like apparently 3 hours, 45
Okay.
minutes or something. And they, like, if it wasn't going to happen, they were going to, intervene at some
Yeah.
point. But then I just really pushed and ended up getting like a 3rd-degree tear.
Oh no.
And oh my God.
Oh.
And I found actually, I think because of the adrenaline, I found the stitching at the end
Yeah.
down there, even though
Yeah.
local anesthetic, worse than the whole 24 hours of labor. I was just like, what is he doing to me?
Yeah, definitely.
So then they give you the baby, you do the skin to skin. And I was so
Yeah.
lucky that I was in a breastfeeding a hospital that really focused on breastfeeding.
Okay.
So they really did push for the baby to feed
Oh, great.
that day. But then the
Yeah.
next day, he wasn't really feeding. They said he was exhausted, and the nurse that
Okay.
looked after me during the day wasn't really pushing for the feed. So
Mm.
I would try, and when he wouldn't latch. I would just be like, okay, well, he must be tired because that's what the nurse told me.
Yeah.
And then at night, his blood sugars were really low because he hadn't
All
fed at
right.
all. So we
Yeah.
had to do like an emergency like formula type of thing.
Okay.
I think they had to feed like every other hour, maybe every
Yeah.
second hour. And but the good thing is they would put the tube near my nipple, so they were
Yeah.
trying to get him to latch with the tube in there as
Yeah.
well. So that really helped me, but it was so stressful.
Yeah, definitely.
So
Yeah.
so stressful, and it took about a day or two to get him to even start latching properly.
Yeah,
So I know the stress of that and
definitely.
the engorgement. I'm pretty sure I had
Mhm.
mastitis, but I didn't tell anyone because I was just like,
Okay.
well, it's part of being a mother. But
Yeah.
I was shivering. I was like,
Oh.
no, I didn't know at the time. And I was home a lot by myself because
Yeah.
studying and working.
Yeah.
And I was lucky I was able to not study at the time. Um, but yeah, it's just such a difficult time.
Yeah.
So sticking with it is a huge thing, but even not sticking with it, I think you have to kind of consider like your mental health as well.
Yeah, exactly.
For
Yeah.
some women,
Yeah.
that's important for them to give up. But for me, I was like you because I was so determined. I would have felt like a failure
Yeah.
if I didn't. So I would have been worse for my mental health. So that's
Yeah.
why I persevered. And so that was Elijah, and I fed him until recently, until about a month and a half ago.
Oh wow, okay.
Yeah, so
Yeah.
and he's 4.
Yeah.
He's gone to P1 now, and
Okay.
then I'm still feeding the 2-year-old.
Yeah.
But I think he's gonna stop earlier. I can already
You
tell.
can tell.
Yeah, so I'm excited about that. Anyway, enough about that. What is the importance of breastfeeding? Why do you think it's so important? Or
So
scientifically?
yeah, so I guess maybe starting with the baby, definitely a good nutritional kind of it meets their nutritional needs in the first 6 months for sure, and then obviously they get your antibodies as well, so they're protected against infections, especially kind of respiratory and gut infections is the big one that is helpful towards.
Mm-hmm.
And then other things like just kind of further along the line, kind of reduce risks of kind of childhood obesity and kind of diabetes would be big things. And one thing kind of in early life, sudden infant death syndrome, that is known to kind of reduce the risk of that as well. So
I wonder why.
I actually don't. I don't know.
Yeah.
I don't. I'm not. I wouldn't know that offhand. But I don't know if it's maybe because of the antibody effect. You know, if they're getting your antibodies, maybe they're just, you know, it helps with their immunity, helps prevent reduce the them getting infections or any kind of problems with asthma or, you know, sensitivity in the airways. Maybe something to do with that, but I wouldn't. I don't know for sure.
Yeah.
But they certainly is statistics to say that even increasing rates of breastfeeding would reduce the the cases of sudden infant death. So
Wow.
there's definitely a link there. And yeah, I mean, from my experience, even with Richie, he's barely been sick, and if he's been sick, it's just been really minor kind of viral illnesses that he's not, he's only had a temperature once in his life, and that was literally a few weeks ago, actually. So up until kind of 20 months, he was, no temperature. He always managed his minor illnesses, like a bit of a runny nose or congestion. He always managed it really well. He kept feeding, maybe feeding more during that time. And it just seemed like he was, he wasn't really affected by it, So I feel that those have been benefits, for us, certainly anyway, for now. So
us too, with like, for example, Ezekiel has a runny nose. He's had it for the last 3 or 4 days and no temperature at all. Just the runny nose.
And I think maybe then moving on to the mother, you asking about benefits. There's also benefits for the mother as well. So there's evidence out there that it reduces the risk of breast cancers, in the female cancers, ovarian and endometrial cancers, and then again type 2 diabetes and heart disease. And I think those are probably the main ones. Osteoporosis, I think, as well, in women. So there's generally a good health benefit from it. You might not notice the effects of it definitely, but I mean, if you're able to do it, you never know what you're reducing for your future. So
I didn't even know the benefits for the mother, I guess, because I was focusing, like, for a long time. I was focusing on just my baby, and for me it was more I have a lot of abandonment issues, so I was just like, I'm just gonna make my baby feel loved. That was my main reason. But it really makes me happy because I had gestational diabetes with both pregnancies, and I know that so one of the things they kept telling me was that you might actually, after the birth of my first baby, they thought it wouldn't go away. They thought I was going to end up being type 2 diabetic, but I didn't. And I'm not saying that I'm completely free and it might never happen, because I'm still on my weight loss process. But with the second baby, it was really, really bad. And again, they were just like, we think you might end up being type 2 diabetic, but we did the test. Was it 6 weeks later or whatever weeks you have to wait?
I think it's about 6 weeks.
And I was back to normal. My sugars were fine, and I was just like, thank God, because the doctor in America was just like, this is it. I don't know if he was trying to scare me, but so I think it might be partially because of breastfeeding, and especially with the second baby, I was breastfeeding too. I was doing tandem breastfeeding, so maybe it might have helped. I don't know. But breast cancer and ovarian cancers, Edith, I was on a thing that, you were there yesterday as well. About the diseases of affluent women because of excess estrogen. So I guess, and especially Black women of color have more estrogen in them. So it might be of benefit for us to breastfeed more if it reduces the risk of breast cancer. So we just celebrated 2 weeks ago the Black Breastfeeding Week. Why do you even think that we have a Black Breastfeeding Week?
So I guess it all actually was quite new to me. I just found out about it on social media, a few weeks ago. So just maybe doing a little bit of reading up about it. I've just kind of found out a bit more about why they do it. And like for sure, you know, I mean, it's been one of your discussions that you've had even in the past with Edith about kind of, you know, postnatal, you know, infant mortality and, you know, Black women and death during pregnancy and after pregnancy. And so one of the things would be kind of infant mortality, and that kind of maybe goes back to kind of talking about the sudden infant death syndrome as well. That's all part of it. All of that is, you know, can be reduced by breastfeeding, and it's not something that, you know, the Black population have high rates of doing, you know. So I think certainly there's been, it seems to be maybe a lack of support or education, or just people kind of color who are in those fields of kind of high levels of support, you know, leadership for kind of breastfeeding support, you know, lactation consultants. Maybe there isn't as many Black people in those kind of lines of work. Certainly one of the other issues would be, you know, I know about a little bit about the history of kind of Black women and breastfeeding, how they were wet nurses, and just kind of the history of it that's kind of maybe come along the lines and affected women in that way. So yeah, it seems to be a number of kind of different factors really that's affected maybe the Black women in particular. Not to say it's not challenging for everyone, because certainly, yes, breastfeeding is challenging for all women, you know, at different levels, but there's just kind of those added kind of measures there, you know, just for that Black women has faced. I mean, certainly for myself, I must say that I haven't been negatively affected, you know. It hasn't been something that's kind of come along the lines of, you know, from generation to generation, that I've had a negative impact to not breastfeed, if you understand what I'm saying. But I just feel that, even obviously I do have to embrace myself as a Black woman and understand maybe the support that or encouragement that I can give, you know, just as someone who has been breastfeeding for this period of time as well. And I think that would be the importance for me, maybe just to kind of maybe try and be a bit of a role model, and for others to kind of see that there is support.
I think in different countries there are different reasons. So I think in America, definitely the slavery aspect and being wet nurses, and also the fact that you have single mothers a lot. For example, the church I used to go to, there was a lady, and I think she had about 8 kids, and they were all, I think, under the age of 10.
Oh wow.
And a lot of them were from different dads, and there was not a father at home, and her and her sister lived in the same house with all their kids, and there was about 16 kids between them.
Oh wow.
So and they were the breadwinners. They were she didn't really breastfeed, and I completely get it, because she's exhausted all the time. And then they were from, so I gave birth in Indiana, and the church was actually in South Bend, Indiana, and it was kind of like really poor area, Black area, where shops have closed, just the living conditions aren't great. So I think everybody's just trying to survive in that sense. And then breastfeeding is just not convenient when you have so many kids and you're the only one working and you're trying to support everybody. So I think there's that element as well. But I think and then for me, being African, directly from Africa, I think with younger Black women, African women now, we just don't think it's cool. You know. And I remember thinking to myself, this, so first of all, I didn't want kids. When I was in my early 20s, coming up to my mid 20s, I was just like, no, I want to pursue. You know, if it wasn't medicine, I was going to have a PhD by 30. Like, I just wanted to just, you know, excel and be great. And kids would just seemed like an inconvenience. And I thought, okay, if my husband wants one, I'll have one. But I won't breastfeed. You know, and for me, it was just not cool. I didn't want my boobs to sag. So imagine this. So I feel like with a lot of younger Black women from Africa, directly from Africa, there's an element of it's just backwards. It's what our mothers and our grandmothers did, and it's just not cool anymore because we can afford to buy formula and keep going to work. I'm not sure in England, maybe what you've said applies to England as well, the Black women in England, because it's a different dynamic. A lot of them, you do have Africans, but you have more Caribbean influence. Is breastfeeding a big thing amongst Caribbean populations?
I mean, I guess I don't know for sure. I mean, my background is Caribbean, so my dad is Jamaican, my mom's half Trinidadian, and my mom's half English as well. So, but I didn't kind of grow up with that strong Caribbean influence. So I'm not really actually sure what my grandmother on my dad's side even did in terms of breastfeeding. I know that my mum, she may have breastfed for the first few months, maybe 3-4 months of our life. But there was never any kind of big thing about breastfeeding kind of through our history. And certainly my sisters, they didn't seem to have any kind of issues. They just kind of took to it. So a couple of my sisters have breastfed. One has fed three boys, like for maybe up to 2 years each as well. So they've been a good kind of inspiration to me as well. But kind of wider than that, I'm not quite sure about the whole overall Caribbean population, but I know certainly in the UK that rates of breastfeeding is low, the same way as in Caribbean, and even just among any populations, but specifically Black populations. And I know that work and kind of, as you say, the work side of things, having to go back to work and support families, that is a big factor, because you do need a lot of support for breastfeeding, certainly. So, and then maybe just a bit of cultural diversity within kind of support groups and things like that, probably maybe the bigger things. And so
it's quite interesting, isn't it? And it's funny, right? Because I was back in Kenya 3 years ago, and I had my little breastfeeding cover, and Elijah was constantly feeding, and I breastfed exclusively for about a year.
Oh wow, that's great. That's great.
he just even now, like if he wasn't going to school, and if he didn't think, if people hadn't mentioned that he's a big boy, he would still be feeding. But so breastfed exclusively for about a year, and then I went to Kenya when he was about 15 months, maybe 17 months. And I had my little cover, and I'd feed him. But even then, there were comments from older African women saying, "Is he not too old to be feeding?" And then, because I was covering myself, my cousin's wife was getting a hard time because she wasn't covering herself. In Kenya, it was never a thing. I don't remember women covering themselves when I was little. I remember them just, taking the boob out and breastfeeding. And it was older women who did it. And I remember just being really confused. I'm like, you're making this harder for us. Like, you don't understand. Our peers are not breastfeeding. So the fact that we're breastfeeding, like, just give us some credit. And
it's true. I think there's definitely a lack of knowledge. I mean, I guess through the generations, it may have just seemed like a normal thing when they're babies. But certainly, even, just the quote, the WHO, it is actually proven to be benefit up to 2 years and beyond, and people don't know that or realize that. So I think there certainly are a lot of comments about, even I think I even get some now, even that Richie's getting older. That's probably the most comments or most involvement that people have for comments. But I just say, look, the WHO recommends it up to 2 years and beyond. It's not a big deal for me. I choose to do it, and that's my way of. Even bonding is the big thing, like you were talking about earlier. Just bonding with a child, even making them feel secure. There's psychological benefits even for it. There's just a lot of comfort can meet a lot of needs, really. So I'm happy. I think it is it's good to educate people of the benefits of it, and how long it can be beneficial for. Certainly,
I agree, and I think men are I'm always, no, I'm not always very careful, but I'm starting to be very careful what I say about men.
Okay.
But a lot of men don't help in this
Mm,
situation because I know a lot of men and black men who
yeah.
think that breastfeeding over 6 months is sexual. Like,
Oh,
the mother must be getting some pleasure somehow.
that's such a
So they
shame.
are really hard on their wives if they're
Mm,
breastfeeding longer than that. And then I had
yeah.
a guy, he had never met me before. He met
Yeah.
me once.
Yeah.
My baby was only like a few weeks old. Because remember, I met you guys, I saw you guys came
Yeah,
over
in
when you were
Michigan.
in Michigan. Yeah,
Yeah.
it was around that time
Yeah.
actually. Um, so my baby was just brand new, like
Yeah.
really brand new. And this guy is just like, so when is he getting the eviction notice? And I was pretty
Oh,
confused, right? And I hadn't picked up on it because I was like, first of all, nobody would ever talk about my boobs.
yeah.
Like that. And then
Yeah.
second of all, I was just like, eviction notice, like, can we even start talking about, So I was just,
Yeah.
I don't know, when he's 18, like, because I thought he meant like, when will he move out and have to be like
Yeah.
an adult or whatever. And he was just like, no, 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 I mean breastfeeding.
Oh, dear.
And I was just like, why is this even a conversation?
Yeah.
Like, I've just given birth to this
Yeah.
child. So yeah, the men don't help. Other women definitely don't help. And I find that there's a huge divide between
Yeah.
breastfeeding women
Yeah.
and non-breastfeeding women, and you either do one or the other. And then
Yeah.
I find here in Northern Ireland, the women who breastfeed also co-sleep. And I'm not judging on co-sleeping. I've done
Mm,
both
mm,
co-sleeping, which is not
yeah.
safe. I am not telling you to do it.
Yeah.
But it worked for me at the time. And then at a certain point, I knew Ezekiel was ready for his crib, so I put him in the crib. And I remember
Yeah.
telling the breastfeeding women, and they were just like you've put
Yeah.
your baby in a crib,
Yeah.
you know. And I was just
Oh,
like, can I not just be in between where I'm
yeah.
breastfeeding and then my baby gets to sleep in his bed so that
Yeah.
I can get.
I know. Yeah, we've always gone more towards putting him in this crib as well. Like I didn't have
Because
the
it's
next to
safer.
me cot, so yeah, he would go in his crib.
Yeah,
Even from 9 months, he was in his own room as well, so that
yeah,
was good for us. And
yeah.
no, I'm just blessed because I have Rick, my husband, has been really supportive. So
Mm,
there's no question
yeah,
about giving up. He's not going to question me or pressure me or anything
yeah,
like that. So
yeah.
yeah, I think
I love
yeah.
that. Tim's the same,
Mm.
but it's been a journey too. Because before we had kids, we were both like, no breastfeeding, and
Oh,
then
okay.
we had kids, and we're just like,
Yeah,
it's way cheaper. You don't need to
yeah,
make formula, like
yeah,
you don't need to warm it,
yeah.
and he's and like
Accessible.
any
Yeah,
anything that saves money, Tim's just like,
yeah,
yeah, let's do it. And so
yeah,
it doesn't bother him at
yeah,
all. And I've
yeah,
had like relatives who were just like, does it not affect your sex life or whatever? I'm just like,
mm,
no, I think
yeah,
you can separate,
yeah,
and I think for a long time, you just like your boobs kind of lose that function for me, but I'm still attracted to my husband, but it doesn't have to
yeah,
be,
yeah,
but so I just think boobs have been over sexualized, especially
yeah,
in black communities.
mm,
You look at music videos, black music videos, especially, I was gonna say especially from America, but that's not true.
mm,
Afro beats as well, they do it,
mm,
boobs and bum and whatever, and it's just
yeah,
over sexualization of the
yeah,
woman's body that we miss out on the benefits
yeah,
of breastfeeding, and also the woman, even though it looks like she's liberated, and she thinks she's being liberated, but she's given up the good things for the
yeah,
name of liberation as well. And I'm
yeah. I
speaking
think.
as like a Jesus feminist, a womanist. I completely believe that I have a right to take my rightful place beside the man, but I was created a woman, and there are things
Yeah,
that I can do that men cannot do. Like
yeah,
I carry life,
exactly. Yeah, and even
and I sustain life.
exactly,
You
and
know,
the ability that we even can produce, just the way that we produce milk and the baby sucking
yeah,
to get the milk that they need,
yeah,
it's just all of it is just amazing, and that's what it was created. That was the
hmm,
purpose. That was one of the purposes it was created for. It's just
yeah,
a natural thing,
yeah.
So
And even like when your child is sick, your body, the antibodies formulates so that, you're producing milk that's going to help heal your baby. Or like when you're doing tandem breastfeeding. So Ezekiel was always on the right team. Elijah. And they say that it matches for the child's needs.
Oh, yes, exactly. Yeah. And it's amazing that you've done tandem feeding. That's really a great feat.
So it matches for each child. Like, that's just like, we are like the definition of the image of God.
Definitely.
Yeah. Oh, okay. Well, I think we're coming to the end of this. So I don't even know how to end this. It's quite different from my usual ones. In my usual one, I'm always talking about race and racism. But I'm just so happy that you joined me. Thank you for sharing your story, and your experience as a mother, as a Black mother, and as a doctor, a working woman as well, who's able to kind of sustain both breastfeeding and working. And I'm grateful for your husband, for all that he's done to support and help you in this. And I just think it's amazing. Is there anything you would like to say to the women listening to this?
I think first of all, yes, just acknowledging that it's not easy, I think, is the first thing. Don't put too much pressure on yourself, though. I mean, it's easier said than done. We do tend to, or some of us maybe do tend to put a lot of pressure on ourselves, but there is a lot of learning that has to go on between you and your baby just to really establish and get into the flow of breastfeeding. And definitely a lot of support is needed, and there is support available. That is the other thing. So there are groups out there, mum and baby groups, even breastfeeding groups online, and even the Sure Starts, the local groups. So even if you feel like you're not sure what to do, there's always help. And even if you're not sure about continuing with breastfeeding, I think that's another thing. There are kind of certified lactation consultants who can kind of assess you and help give you kind of help where you might need help if you're thinking about stopping as well, and because of the challenges you're having. So there's certainly a wide range of help out there, and but do what's best for you, though, is the main thing to kind of take away. Maybe there are lots of great benefits of breastfeeding. I do encourage it. If you can do it, please do give it your best go. But don't pressure yourself to if it really isn't working out, then just kind of take a step back and see where you can get help to continue. So it's been great coming on and talking to you, Maureen. Thanks for inviting me.
No problem.
And hopefully it'll be beneficial to some women out there.
Oh, I hope so too. But I also wanted to add to your advice that raising a child is not linear. I think we think that it has to be like they go from here to here to here. I think it's more cyclical. Sometimes, and especially when you're breastfeeding, because you get to a point, for example, the month before the baby came, and before Ezekiel came, we still call him the baby, Elijah stopped nursing for a little bit. And then after the baby was born, he was just like, and initially I was kind of like upset about it. But then I remembered an article I read when I first started, and it's that, raising a child is cyclical. And it's the same with potty training. With some kids, you'll get to this point, you'll do so well, and then they'll have an accident and regress for a little bit. And it's okay to just be like, it's okay. It's not a perfect world, and they're still learning, their babies, and don't be too hard on yourself, and don't be too hard on them. I think there's a lot of pressure on children to grow up and just to grow up, and I'm trying to normalize the fact that kids have to be kids, and especially Black kids, because especially Black girls, God hasn't given me a girl yet, but we'll see. I just think just let them be babies for as long as possible, and I think breastfeeding is one of the ways that we can do that. for them initially.
Yeah.
All right.
And
I could talk for Ireland and Kenya, the whole world.
And just enjoy. No, I mean, the last thing I wanted to say was just try and enjoy it. Once you've established and you're comfortable with it, it is a great bonding process, and there are good, definitely a lot of good things about breastfeeding as well. So, yep.
Yeah. Oh, thank you so much, and God bless you.
Thank you very much for having me. All right.